Impact Strategic Consulting, COVID-19 Safety for Small Businesses. Overview. 1. COVID-19 Overview. 2. Hygiene and Prevention. 3. Workplace Hygiene and Prevention. 4. Best Practices for Food and Beverage Businesses. 5. Resources. What is COVID-19? COVID-19 is a disease caused by the SARS-CoV-2 virus that can trigger a respiratory tract infection, affect your upper respiratory tract, sinuses, nose, and throat, or lower respiratory tract, windpipe, and lungs. Cause long-lasting effects in those with a severe infection, including difficulty breathing and thinking clearly, chronic cough, fatigue, or headaches. Who is most at risk from COVID-19? While the intensity of symptoms differ from person to person, those at risk from more severe, even life-threatening symptoms include individuals who are of older age, including those in their 50s, 60s, 70s, 80s, and beyond, facing increasing risk the older they are, suffer from long-standing health issues, including but not limited to cancer, diabetes, obesity, heart conditions, and chronic lung, kidney, and heart diseases. Even if your symptoms are not severe, you can still easily spread COVID-19 to those without your level of immunity. How does COVID-19 spread? COVID-19 spreads mainly through person-to-person contact, typically through aerosol droplets spread by coughs or sneezes. The CDC warns that individuals can be infected with COVID-19 by breathing in air when close to an infected person who is exhaling small droplets and particles containing the virus. Droplets and particles containing the virus landing on a person's eyes, nose, or mouth, commonly through coughs or sneezes. Touching eyes, nose, or mouth with hands that have the virus on them. What are COVID variants? Like any virus, COVID is regularly mutating. The CDC warns that variants can be more infectious, spread faster than earlier forms of the virus, and may cause more severe illness than previous strains in unvaccinated people. However, vaccines continue to reduce a person's risk of contracting the virus and are highly effective at preventing hospitalization and death. Fully vaccinated people infected via a variant despite being vaccinated, known as breakthrough cases, appear to be infectious for shorter periods. This variant is prevented in the same fashion as the original SARS-CoV-2 virus. Forbid COVID-19 policies. As government and businesses continue to adapt to the changing COVID-19 landscape, employees are encouraged to review the following to stay current on the local policies. Click on the following links to find out more information on these topics. Knowledge check. Select the correct answer. True or false? The COVID-19 vaccine does work against the Delta variant. Choose A for true, B for false. If you chose A, you're correct. Vaccines continue to reduce a person's risk of contracting the virus and are highly effective at preventing hospitalization and death. Fully vaccinated people infected via the Delta variant despite being vaccinated, known as breakthrough cases, appear to be infectious for shorter periods. For more information, click on slide 7. How do I protect myself against COVID-19? To prevent the spread of COVID-19, you are encouraged to get a COVID-19 vaccine, practice good personal hygiene, keep 6 feet away from others whenever possible, wear a face covering over your nose and mouth indoors or within 6 feet of others. How do I practice good hygiene at home and work? To prevent the spread of COVID-19, you are encouraged to wash your hands often with soap and water for at least 20 seconds. Use hand sanitizer with at least 60% alcohol. Clean surfaces and things you touch often with soap and water, bleach solutions, and Environmental Protection Agency (EPA) registered disinfectants. Always cover your mouth and nose with a tissue or inside your elbow when you cough or sneeze. Monitor your health daily and be alert for COVID-19 symptoms in yourself and others. Watch for fever, cough, shortness of breath, and other symptoms.
What kind of mask should I wear? Regarding masks, the Centers for Disease Control and Prevention, CDC, recommends that employees wear masks that completely cover the nose and mouth, have 2 or more layers of washable, breathable fabric, fit snugly against the sides of their face without gaps, have a nose wire to prevent air from leaking out of the top of the mask. Additionally, they recommend against wearing masks that are made of fabrics that make it hard to breathe, like vinyl, have exhalation valves or vents, as these allow virus practices to escape, are surgical N95 respirators, as these are for healthcare professionals.
Are you experiencing COVID-19 symptoms? Click yes or no to find out more.
Knowledge check. Select the correct answer. Which of the following is not a good hygiene practice? A. Washing your hands. B. Cleaning surfaces. C. Covering your mouth and nose when you cough or sneeze. D. Using hand sanitizer with less than 60% alcohol. If you chose D, using hand sanitizer with less than 60% alcohol, you're correct. The CDC recommends using hand sanitizer with at least 60% alcohol. Knowledge check. Select the correct answer. What kind of mask should you wear? A. A vinyl mask. B. Surgical quality N95 respirators. C. One with 2 or more layers. D. One with vents. If you chose C, you're correct. You should not use non-breathable materials, such as vinyl, as masks. You should avoid using surgical quality N95 respirators, as they are needed by medical professionals. Masks with vents may spread the virus. You should, however, wear masks with 2 or more layers of breathable fabric. For more information, click on slide 13. What kind of mask should I wear?
Work with your employer. To improve workplace sanitation and reduce the spread of COVID-19 at work, employees should work with their employees to enforce the following company policies: mask, hand washing, testing, if you become sick. Cleaning the workplace. The CDC recommends cleaning and disinfecting high traffic shared spaces and frequently touched surfaces on a regular basis, and if someone who has tested positive for COVID-19 was present in the last 24 hours. To improve your workplace sanitation habits, the CDC recommends employees to work with management to develop a cleaning plan outlining what should be cleaned and how often. Prepare cleaning equipment and personal protective equipment ahead of time. Personal hygiene for employees. Wash hands for at least 20 seconds. Always wash hands with soap and water. Avoid touching the eyes, nose, and mouth. Use gloves to avoid direct bare hand contact with ready-to-eat foods. Before preparing or eating food, always wash hands for general food safety. Cover a cough or sneeze with a tissue or elbow, then throw the tissue in the trash and wash hands.
Knowledge check. Select the correct answer. Which of the following is not a best practice for cleaning the workplace? A. Wash your hands for at least 20 seconds before and after cleaning surfaces. B. Clean high-touch surfaces at least once per day. C. Make special considerations for employees with asthma. D. Use the same cleaning precautions for all cleaning products. If you chose D, you're correct. Not all products may require the same precautions. Read the instructions on the product label of cleaners to determine the necessary safety precautions for using them, such as wearing gloves. For more information, click on slide 20, Best Practices for Workplace Hygiene.
Food and beverage risk types. Masks may reduce the risk of COVID-19 spread, but when worn in any of these risk scenarios. Lowest risk, food service limited to drive-through, delivery, takeout, curbside pickup. More risk, drive-through delivery, takeout, and curbside pickup emphasized. On-site dining limited to outdoor seating. Seating capacity allowing tables to be spaced at least 6 feet apart. Higher risk, on-site dining with indoor seating capacity reduced to allow tables spaced at least 6 feet apart. On-site dining with outdoor seating. Tables not spaced at least 6 feet apart. Highest risk, on-site dining with indoor seating. No reduction in seating capacity. Tables not spaced at least 6 feet apart. Best practices for food and beverage businesses. This addresses key considerations for how foods offered at retail can be safely handled and delivered to the public, as well as key best practices for employee health, cleaning and sanitizing, and personal protective equipment.
Knowledge check. Select the correct answer. What risk scenario for food and beverage establishments is displayed in this image? A. Low. B. More. C. High. D. Highest. If you chose D, you're correct. Highest risk scenarios have on-site dining with indoor seating, no reduction in seating capacity, and tables not spaced at least 6 feet apart.
Click the following links providing additional information and resources for Fort Bend County and Texas State safety guidelines. Click the following links for resources and citations on more useful government COVID-19 resources.